Hello. Today we're going to talk about enhancing senior healthcare, a community-based approach. And as we delve into the healthcare challenges faced by our aging population, it's crucial to understand the unique needs that arise with increasing age. The world is seeing a significant rise in the number of older adults, a demographic shift that brings to light the critical need for accessible healthcare services tailored to this. Um, a study found in 2020 underscores this point, highlighting the importance of health promoting and preventive interventions specifically designed for community dwelling older people. Their research, published in the Archives of Public Health, provides valuable insights into the effectiveness of community-based solutions in addressing the healthcare needs of seniors. It does emphasize the needs for services that are not only available, but also accessible and suited to the unique needs of this population. So in these healthcare challenges, we're talking about rising elderly population and unique healthcare needs, community-based solutions importance, and accessibility and navigation challenges. In communities like where I live in Canyon Lake, the gap between available health services and accessibility of these services to the elderly is particularly pronounced. This disparity underscores the urgent need for targeted, community-based healthcare interventions that can bridge this gap. It does ensure that seniors have the support they need to live healthier, more fulfilling lives, and we educate them. Today, we're here to explore how we can address these challenges head on, drawing on the findings of Bacharkardi, Sandland, and Zingmark, and others to inform our approach. So let's discuss how we can implement community-focused strategies to improve healthcare accessibility and effectiveness for our seniors, making a tangible difference in the lives of older adults in Canyon Lake and the surrounding community like Sun City. Preventative healthcare. Our bullet points are low use of preventative services by seniors, need for awareness and accessible programs, and barriers to accessing care. In our journey to enhance senior healthcare, we encounter a critical yet often overlooked aspect: preventative services. Despite their proven efficacy in improving long-term health outcomes, these services are markedly underutilized by the senior population. But why is this the case? The Centers for Disease Control and Prevention shed light on this issue in their 2019 report, Healthcare Industry Insights: Why the Use of Preventative Services is Still Low. The report highlights a concerning trend. A significant portion of our elderly community is not taking advantage of preventative healthcare services, primarily due to barriers in accessibility and a lack of awareness. This revelation is not just a statistic, it's a call for action. In our communities, it emphasizes the pressing need to make preventative services more accessible and to raise awareness among seniors about the benefits of these services. Can you imagine a healthcare system where every senior is informed about and can easily access preventative care, a system where barriers to access are dismantled and health equity is a reality, not just an aspiration? As we consider the path forward, let's draw inspiration from the CDC's findings. The goal here is to create a community where preventative healthcare is not an afterthought, but a fundamental aspect of senior care. By focusing on improving accessibility and awareness, educating, we can ensure that our seniors are taken care of. So, misunderstandings about preventative healthcare. Moving forward, the misconceptions about preventative care are bullet points for tonight: knowledge gaps among seniors and impact on service utilization. So moving forward, we'll address the significant barrier to the utilization of preventative healthcare services. Misunderstandings and knowledge gaps are critical. Many seniors hold misconceptions about the nature and benefits of preventative care, which impacts their willingness to seek out these services. Graham Weissman and Moore study in 2021, published in JAMA Health Forum, highlights this issue. They discuss the barriers to advancing mental health equity, particularly in rural communities, which can be exfoliated to preventative health care at large. Their findings reveal a profound lack of awareness and understanding among older adults regarding available preventative services and their potential benefits for them. The knowledge gap is not just an individual issue; it's a systemic one that affects healthcare utilization rates among seniors. By us addressing these misconceptions and educating our senior population, we can enhance their engagement with preventative services leading to better health outcomes. As we consider solutions, the insights from Graham, Weissman, and Moore remind us of the importance of clear communication and education. Um, Proposed project impact. In the analysis that I did, we emphasized the critical role of the stakeholders' involvement in enhancing healthcare outcomes for seniors. By integrating insights from various stakeholders, including healthcare professionals, community leaders, seniors themselves, we can develop a comprehensive approach that addresses the needs of the elderly in Canyon Lake and the surrounding area. Um, the project aims to improve accessibility, enhance awareness, and foster community, making healthcare services more accessible to seniors. Um, by enhancing awareness, increasing awareness among seniors about the importance of availability of preventative health services, and by fostering community involvement, it encouraging active participation from the community and stakeholders that we've talked to in the health and well-being of seniors. And by focusing on these objectives, we anticipate significant positive impact in Canyon Lake seniors and Sun City, the surrounding area. The project success will serve as a model for similar initiatives, hopefully demonstrating the effectiveness of community-based interventions and the importance of the stakeholder collaborations in improving the senior healthcare. Stakeholder involvement. We spoke to quite a bit. Some we did not get a hold of, many we did. In our collaboration to enhance senior healthcare in Canyon Lake, the synergy among our stakeholders is pivotal. I think each brings unique strengths and insights driving the project towards success. Fire Chief Ed Jensen has been instrumental. He offered not just support, but also integrating crucial disaster preparedness into our health initiatives, ensuring the safety and well-being of our seniors in all circumstances. He would do call-ins, he would do wellness checks on our seniors. Moving into Joey Gray from Promise Care, she lends her extensive experience in senior healthcare, guiding our projects to be both effective and sensitive to the specific needs of the community. Transportation, education in our senior centers, she's very active in that. The Canyon Lake Senior Center and the Cay Cisneros Senior Center stand as essential conduits for directly engaging with seniors. Primarily Cay Cisneros, that senior center is very active online, both online and with their seniors in person. They help make healthcare services accessible and ensure that senior feedback shapes the project planning. And then the last was Steve Adler. We briefly discussed ways to improve the senior health care. He is a deacon of the Canyon Lake Bible Club, brings a unique perspective, fostering a strong community spirit, ensuring that our initiatives resonate on a personal level with seniors. His involvement bridges the gap between healthcare services, community values, and the importance of spiritual and emotional well-being with our seniors. Um, and So individuals like Fire Chief Ed Jensen, Joey Gray, Steve Adler, alongside our community centers, exemplifies the power of unity in transforming senior healthcare in Canyon Lake. And conclusion, as we conclude our presentation, it's clear that the path to improving senior healthcare in Canyon Lake and the surrounding areas, such as Sun City, is both promising and achievable through the insights and efforts of dedicated stakeholders, including Fire Chief Ed Jensen, Joey Gray, and the vital support from the Canyon Lake and Cay Cisneros senior centers. We're poised to make significant strides in enhancing the well-being of our senior community here. This project is not just about addressing immediate healthcare needs, it's about building a sustainable, community-focused framework that prioritizes the health and happiness of our seniors. The collaboration between healthcare professionals, I believe community leaders, local organizations, it really does underscore the holistic approach necessary for meaningful change. And we stand at a pivotal moment, really, where the support and involvement can truly make a difference. Whether we're a healthcare professional, a community member, or someone with a passion for improving senior healthcare, there's a role for people to play. And I think together we can transform the landscape of senior healthcare in Canyon Lake and Sun City. thus ensuring a healthier, more vibrant future for our elderly population. So thank you very much for listening to my presentation.